Madam Secretary, in the Health Care Act, 2010, 2011, it provided for basically 1.1 billion for the prevention fund. And under the prevention fund, you have the authority, I guess almost unilaterally, to move that money into various accounts at HHS. So I'd like to ask you to provide to the committee for the year 2010 and 2011 the amounts of money that was transferred to which particular accounts, and then from those accounts, if grants were made to grantees out around the country, the name of the grantee, the amount of the money, the purpose of the grant, and the date of the grant. Would you be able to do that for us?
I would be happy to do that.
Thank you. Thank you very much. Now, one of the things that is a little bit troublesome to me in the President's 2013 budget is that he, in essence, eliminates part of the anti-lobbying provisions of the use of federal funds. As you know, in the appropriation bills since the mid-'70s, we've had prohibitions against using federal funds for lobbying, and to define it more specifically, prohibits using federal funds being used to influence in any manner an official of any government to favor, adopt, or oppose by vote or otherwise any legislation, law, ratification, or policy. Why would the President want to omit that from his FY 2013 budget?
Mr. Whitfield, I have to confess I'm not sure exactly what is being referred to. I know that our FY 12 budget, our budget,
Right.
and there may be other statements in other budgets that I'm not as familiar with, but our FY 12 budget actually included additional lobbying restrictions which we are actively working to comply with, which not only apply to our department, which have been in place for traditionally for years and we have complied with in terms of lobbying, but also now apply to downstream grantees who receive money through the prevention fund. So we're updating our grant language, enhancing our oversight of grantees, retraining people.
Well, I mean, I think that's commendable, and I do appreciate it, but the President, the prohibition has been very specific about using those funds at the federal level, state level, or local level. And the President explicitly in his 2013 budget allows those funds to be used at the local level. And my question to you would be, do you know why that action was taken by the White House?
Again, I would be, I will provide a more thorough answer in writing. What I've just been told by our staff is that the language that we are proposing be eliminated is duplicative of existing law, that it already exists in statute. And I will verify that and get back to you, but I am not aware of any new measures that we're talking about.
So from your perspective, you're already doing that.
That's what I...
Now, the reason I'm asking the question is because I have 7 pages here of 25 specific instances where grantees of HHS receiving money from HHS are explicitly trying to influence laws at the state and local levels relating to all sorts of issues. For example, in one town in California, Baldwin Park, they're using these, the entity, the grantee is using this money to reduce the density of fast food establishments and convenience stores, for example. And we have 7 pages of this, and it looks to me, just on the surface, that it's explicitly violating the law as set out in the Appropriation Act.
Again, Mr. Whitfield, the new language in our budget for FY 2012, we have not issued any new grants where that new language would be applicable. We are updating our grantee advice, we are updating, but the prospective language has not impacted any of the grants in place. We are going to comply with the law. The language that has been statutory applied to our use of our federal funds, we have also complied with that law for years. So I can assure you that the new language attached to the FY budget, and it did go beyond statutory language, is one that we are currently updating and updating grantees about, but there have been no grant releases where that new language would apply.
Well, Mr. Chairman, I might just make the comment that it was my understanding that this prohibition also applied to FY 210 and 211. So, but thank you very much.
Not by grantees,
Chair.
Mr. Whitfield. It applied to us, but not our grantees.
Okay.
Chair, thanks, gentlemen. The gentlelady from Illinois, Ms. Schakowsky, is recognized for 5 minutes for question.